I would hope that people know that, not to generalize all Asian people as, being a carrier of coronavirus or being related to somebody who's a carrier of coronavirus. I had a patient who was brand new to me, and it was a telephone visit. So all done via telephone. I have no idea what she looks like. She has no idea what I look like. Towards the end of the visit, she started, asking me some questions about myself as a physician. She asked me where I'm from. She asked me where I went to med school, went to college, and all these little things. One of the last questions that she asked was, what's your ethnicity and your nationality? And I told her that I am Asian, I'm Filipino. Her response was, wow, I can't believe what your people did. I usually wouldn't choose to see an Asian doctor, but you seem nice. That was what she had told me. And I was just absolutely speechless. I asked her if she had any other questions medically, and then I ended the call.
Patient was in the triage room. He kind of like looked at me surprised, like, why am I walking into the room? So I introduced myself. I'm Hanky. I'm one of the nurse practitioners. We give him the mask, and instead of putting on the mask, he coughed so much, and he coughed right in front of my face. And I was stunned at first. And you can see the bit of the spit on your face shield. I thought that he wasn't doing it by purpose, right? But then he did it again, and then he seems like he was a bit upset, and he said, I don't want to be seen by you. I don't want to be seen by you. And then I said, and why? We're trying to help you. I'm trying to see what's going on. And he stand up and said like, it's because of you I got this, you people. He quoted like, I quoted like, you people, I got sick. And he got up and he left.
My schedule lightened up a little bit in March, so I was like, I'll get back into my life and start doing yoga, which I used to do all the time. We met at the station and we got on one of the cars. It was pretty busy because it was 6:30, so people were still commuting, but we were able to grab a seat. There was this man in the back that was yelling things to no one in particular, just saying things like, F China, F the Chinese, these people eat bats and now my life is effed up. I was very unsettled and very uncomfortable. I was born and raised here in the United States. I've actually never even been to China. And for him to be so ignorant and say all of those hurtful things is really aggravating.
It made me just feel disappointed that, there are people out there that feel this way, and that kind of makes that generalization that what's going on right now can be linked to, certain people or certain ethnicities.
I'm not even from China. I mean, I'm from Indonesia. I've been doing this for almost 10 years now, and I never come across this situation like this before,
Racism is very real, and I'm lucky that I kind of maybe lived a sheltered life growing up, and I never really had to experience overt racism.
Asian doctors we've done the exact same training that other physicians have gone through. We've gone through the same, licensing and certifications.
I worked so hard to try to help people. That's what I really dedicated my life to. And it's really hurtful for someone I don't even know to say those things.
People can feel like they're outsiders, like us. At this time, people can feel like they don't belong in the society that they grew up in and in the culture that they worked so hard to be a part of.
If you want to be in my shoes, I'll welcome you to be in my shoes. I'll welcome you to my occupations. I'll just ask people to actually, treat people like the way you want to be treated.
We're not bad people, and we want to unite everybody because we're all in this together, no matter what race we are.